everyone. This is Tonika Yvonne Wheeler with Behind the Mask, and I am here with the glamorous Sheryll Mithcell of Sheryll Mithcell Ministries. This beautiful lady came out of retirement to help me with my speech and my swallowing. She is a retired speech pathologist, and I have a couple of questions for you, if you don't mind. First off, how important is it that you believe someone that has had head and throat cancer and they've gone through the procedures as far as surgery and radiation, how important is it for them to seek out a speech therapist?
It is very important, and it's important that you do it pretty quick after the procedures, if not during the procedures, for preliminary things to take place.
So would you wait, for instance, when I had my surgery and radiation, my tongue was swollen significantly. Would you wait after the swelling has gone down, or?
Well, I just think immediate interaction is appropriate to get the best outcome. Like if I had been in the hospital, I would have started your swallowing. You know what I mean? Maybe not the touching that we did, the massaging, because you were raw.
Yes.
But I would have started the appropriate swallowing, because we had to go back to tongue on the spot.
Yes.
And swallow. I would have started that in the hospital, even though your tongue was swollen.
Because I forgot.
Yes.
This is how to use my tongue, and that was amazing to me. It's something that you're used to doing on a daily basis.
Involuntary functions of the body. So you had to reprogram the brain to capture those functions again. So that was one that I could have started bedside, you know, just so that the memory would start taking place.
How would you actually determine what type of exercises you would give a patient?
Well, in a clinical setting, you would have done diagnostics on paper, you know, do your assessments, take you through a battery of what you could do and not do. They call it testing. And then determined based on what was needed and what you lost in the process. You would base your exercises and your therapy plan really on that, on your diagnostics.
This beautiful lady has an Your Best Care Day, an annual Your Best Care Day for, is it breast cancer awareness?
Yes, breast cancer awareness, prevention and awareness.
Awareness. Now, what made you start that?
Well, my mom passed, first of all, of breast cancer. And then I saw the need in the community for information. And what do I do? What do I do? Just the knowledge of where do I go, what do I do, who can help me? Because I noticed that young ladies in their 30s were coming up with stage 3 and 4 cancer. And I couldn't sit back and not do anything. And I know that it was a prompt from the Lord to take this on as one of my missions.
So what could someone expect coming to your best care?
Well, you know, you can kind of testify about it. We have speakers and vendors and makeup artists and all of the girly things that we seek after just naturally. And then for the healing, the doTERRA oils, Longview Women's Boutique, and just on and on and on. Anything. It's the best girly morning ever.
So you do call it the ladies' morning out?
Ladies' morning out.
Ladies' morning out.
Yes.
Yes. When is your next event? Have you already set a date for it, or you still?
No, the next event is scheduled for April 28th, 2018.
Okay.
First United Methodist Church from 8 to 12.
Okay.
April 28th.
And I will make sure I post that at the bottom, the date, the website, so you guys can put it on your calendar. You have mammogram exams.
Oh yes, we will have the mammogram mobile from Good Shepherd Hospital. We also do a little other private testing if that's what you want to do through the nurses station that is available for you. There's blood testing that goes on there and also glucose checks. And so that will be available again on next year. And I must commend you on the fabulous job that you did at the 2017 Your Best Care Day. She came out of her cancer experience very gloriously and presented the spoken word with such an anointing that it encompassed the place.